Who is most likely to develop systemic lupus erythematosus? When thinking about who is most likely to develop systemic lupus erythematosus, or lupus, it's important to understand that this autoimmune disease affects people differently. Lupus occurs when the immune system mistakenly attacks healthy tissues, impacting various organs like the skin, joints, kidneys, and brain. The risk of developing lupus is influenced by a mix of genetic, environmental, hormonal, and demographic factors. Genetics play a big role in who may develop lupus. Research shows that multiple genetic factors contribute to the risk rather than just one gene. For example, the C4 gene is a known risk factor. If someone has a family history of lupus, especially among first-degree relatives or identical twins, their chances of developing the disease increase. Ongoing research is helping to identify these genetic markers, which could lead to more personalized treatment options in the future. Another significant factor is sex. Lupus is more common in females than in males. This difference is likely linked to hormonal influences, particularly estrogen. Symptoms of lupus often begin after age 5, with a notable increase in cases after puberty. Hormonal changes during puberty and pregnancy can trigger or worsen symptoms, underscoring how hormones are involved in lupus development. Race and ethnicity also play a role in lupus incidence. In the United States, African Americans have the highest rates of lupus and often experience more severe symptoms compared to other groups. Additionally, Hispanics, Asians, and Native Americans are also at increased risk, suggesting that both genetic backgrounds and social environmental factors contribute to this disease. Environmental triggers can further influence the development of lupus. Factors such as exposure to ultraviolet light, certain infections, and some medications can initiate or worsen the autoimmune response. While we do not fully understand all the environmental triggers, they are believed to interact with genetic susceptibility. Age is another important factor. Although lupus can occur at any age, it is most commonly diagnosed in individuals between 15 and 45 years old. It is rare in very young children and older adults, but it can still happen outside these age ranges. In summary, those most likely to develop systemic lupus erythematosus include individuals with a genetic predisposition, particularly females in their reproductive years, and people from certain racial and ethnic backgrounds like African Americans. Environmental and hormonal factors also affect the risk and timing of the disease. If you suspect you have symptoms of lupus, it is crucial to consult healthcare professionals for an accurate diagnosis and appropriate care.